Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, where we explore the intricacies of tocilizumab and its role in medicine. I'm your host, Dr. Shikha Agrawal, and Prachi Virat is here, our microbiology researcher with a passion for microbiome and bioinformatics. Welcome to the show, Prachi. Let's dive into today's episode Tocilizumab in comparison. How does it stack up against other biologics?
Thanks for the warm welcome. I'm ready for another deep dive, Dr. Shikha.
Let's start with rheumatoid arthritis. How well does tocilizumab work compared to other drugs that treat rheumatoid arthritis by targeting the same pathway?
Great question, and it's an important one since biologic therapies have really changed the landscape of RA treatment. Tocilizumab works by blocking the interleukin 6 receptor, while some other biologics target tumor necrosis alpha factor (TNF alpha) like etanercept and adalimumab. In head-to-head trials like ADACTA trial, tocilizumab monotherapy was actually superior to adalimumab monotherapy in reducing disease activity score and improving symptoms in RA patients who couldn't take.
Targeting the same path, how does tocilizumab stack up against other popular RA treatments like etanercept or adalimumab?
Another great comparison, Dr. Shika, while TNF inhibitors like anakinra and adalimumab have long been first-line biologics, tocilizumab have shown comparable and in some cases superior efficacy in clinical trials, especially in patients with high systemic inflammation marked by elevated C-reactive protein (CRP) levels. Moreover, unlike TNF inhibitors, tocilizumab consistently reduces acute phase reactant like CRP and ESR more dramatically, which can be advantageous in patients where controlling somatic inflammation is a priority. The safety profile are somewhat similar in terms of infection risk, though tocilizumab tend to cause more transient increase in liver enzymes and cholesterol.
Let's switch gears to COVID-19. How does tocilizumab compare to other biologics being used to treat COVID-19 related inflammation?
Excellent pivot. In COVID-19, tocilizumab has been one of the most widely studied biologics for controlling cytokine release syndrome (CRS) and hyperinflammation. Other options like sarilumab, IL-6 receptor blocker, and anakinra and IL-1 receptor antagonistic have been investigated. The landmark recovery trial showed that tocilizumab reduced mortality and the need for invasive ventilation when needed to in standard care in hospitalized COVID-19 patients with significant inflammation. Sarilumab showed similar, though slightly less, consistent benefits in trials like REMP, CAP. Anikra showed promise in small cohorts, particularly in hyperinflammatory phenotypes.
What factors should clinicians consider when choosing between tocilizumab and other biologics?
Really important question. The choice depends on several factors. Let's break it down step by step. First is mechanism of action. Whether IL-6 or TNF alpha blockade is more appropriate for the patient's clinical presentation. Second is speed and mode of administration. Tocilizumab can be given intravenously or subcutaneously, while some alternatives like anakinra require daily subcutaneous dosing. Third is availability of guideline recommendation. Tocilizumab remain the most recommended IL-6 blocker in COVID-19 guideline like those from WHO and NIH. Fourth is safety profile and infections. Clinician might weight risk of infection, liver issues, and neutropenia. Fourth is cost and hospital protocols. While biologics is stocked and approved locally also matters.
That was a clear explanation. Before we close, what's the key message you would leave our listeners with today?
I would say the main takeaway is that tocilizumab holds a unique place in both rheumatoid arthritis and COVID-19 care, offering potent anti-inflammatory benefit, particularly when somatic inflammation is a major concern. But like any biologics, the decision to use it should be personalized, balancing efficacy, safety, and patient-specific factors.
Brilliant insights as always. Thank you for joining us, Prachi. And to our listeners, if you found this discussion helpful, be sure to follow, share this episode, and stay tuned for our next deep dive. Until then, stay curious.